am Dr. Sharath, consultant urologist and andrologist. So today I am going to talk on female stress urinary incontinence. So what do you mean by stress urinary incontinence? The stress incontinence is involuntary leakage of urination on coughing or straining. So it's most commonly occurs in the middle-aged women. So what are the causes for this female stress urinary incontinence? So usually it occurs in the females of 40 to 50 years of age. The reasons for female stress urinary incontinence are previous vaginal delivery, that was difficult deliveries like it's a vacuum delivery or forceps delivery. So what it will cause? The female stress incontinence occurs because of injury to the pelvic floor muscles. The pelvic floor muscles are the one which will maintain the integrity of the urethra. So if the pelvic floor muscles gets damaged, there is a leakage of urination because of loss of continent mechanism. So what are the symptoms that patients presents with? Usually the patients presents with involuntary leakage and coughing and straining associated with dysuria, burning sensation, pain and frequency urgency. So these are the symptoms. The patients with stress urinary incontinence presents with involuntary leakage of urination and coughing and straining associated with recurrent urinary tract infection symptoms like dysuria, frequency, urgency, all these things. So how to evaluate these patients? These patients we have to take proper clinical history and gynecological history. Do per speculum examination. Per speculum examination, any urethral stenosis, if there is any vaginal prolapse, organ prolapse, that we have to check. And also we have to notice stress test. Stress test means ask the patient to cough and see for the leakage. So in some cases of neurological dysfunctions, and then we have to do the urodynamic study also. So coming to the management of stress urinary incontinence, it mainly involves behavioral therapy and pelvic floor muscles exercise. So pelvic floor muscles alternate contractions and relaxations of the pelvic floor muscles, that is to be done over a period of 3 to 6 months. That will maintain the integrity of the pelvic floor muscles. Even after 6 months, if the patient doesn't improve, then there is a elective surgery that is called transurethral obturator tape. That is called transvaginal or transobturator tape. There is a mid-urethral sling that is placed at the urethra. That is a simple surgery, so that can be done. That will maintain the integrity of the urethra. So what I wanted to tell is, like, most of the women who has stress urinary incontinence and coughing and straining, there is a simple medical remedy. So those who are having the stress incontinence, please do consult urologist. Thank you.